my name's Eileen Salas, and I'm a fourth year dental school at UT Health San Antonio School of Dentistry. In dental school, you are in school for 4 years. The first 2 years are mostly focused on didactic classes, which is when you're taking gross anatomy, pharmacology, and oral medicine, and a lot of other classes as well. Even though they're just didactic classes, you are going to clinic and seeing patients, but not really treating them because we're still, learning. So the main focus is didactic classes. The last 2 years of dental school is when now you're in clinic. We have a whole building dedicated to just dentistry. We have all the branches of dentistry, like root canals, extractions, fillings, crowns, dentistry for kids. So in the last 2 years, that's where you're mostly at, in a building full of dentistry. And mostly every day you do see patients. You see one patient in the morning and then one patient in the afternoon. As a fourth year, I only have didactic classes once a week, and then the rest of my time is spent here in clinic. Again, one patient in the morning, and it can either be, I'm going to be doing fillings or starting them to get ready for a crown or dentures and things like that. I wanted to talk about what I see most though, and what I feel that I should give a message about. And I know usually from dentists we always hear like, oh, you need to be flossing and you need to be brushing your teeth, and we definitely can't stress that enough, for sure. Maybe we might annoy people doing so as well, but it's for a reason, for sure. And the main reason is because I see here almost every day I get a new patient, and they come in and they say, oh, like I have a cavity, like I just want to get it fixed, or my tooth broke, or my tooth hurts and I just want that fixed, and then they disregard a lot everything else that revolves around the mouth, which are the gums and your bone that's holding your teeth there. When a patient comes in and they just want to focus on that one cavity or some cavities, it's good, of course. We don't want to have cavities. But another thing that does get ignored a lot is gum disease. And in our terms, in dental terms, it's called periodontitis. But gum disease is very, very prevalent. And mostly because, if we stop going to the dentist, we're not getting our 6-month cleanings, and, because of life and work and other things, which is totally understandable. But if we let it go for too long, we can definitely be pushing towards suffering from gum disease. Now, there are 2 types of cleanings. There's a deep cleaning and there's just a regular cleaning. When you're being told that you're going to get just, a regular cleaning, it probably means that, your gums are not suffering from gum disease. You might not be having some loose teeth or a lot of plaque or tartar. But once you are told, oh, I have we need to give you a deep cleaning, that's most likely indicative that maybe we have some gum disease going on. And it all starts from accumulation of plaque. And plaque is like the gooey stuff around your teeth that you should be able to take off yourself with a toothbrush if you are brushing in the mornings and at night. As well as flossing, because what flossing is important for is to take off plaque between the teeth. And once that plaque is off, it doesn't mean that it's not going to come back every time we eat, especially things like cookies or kind of sticky food, the plaque can come back. And if it's not taken off by skipping brushing at night, then that means you're leaving plaque there for more than you should. Now, if the brushing and the flossing is being skipped a lot, that means that the plaque is staying on the teeth. And if the plaque stays on the teeth for too long, that gooey stuff that maybe you can scrape off even with like your fingernail off your teeth becomes hard, almost like a rock, and which is what we call tartar. So once you get to the tartar stage, that it's material on the teeth that's stuck, on the teeth, and it's hard as a rock. Now you yourself can't remove that from your teeth. Now you have to get a professional to do it, either a dentist or a dental hygienist. Usually the dental hygienists are the ones that do those cleanings for you. But if that tartar is not removed and it keeps being there, what happens is that your gums start kind of running away from this tartar, because the body wants to protect itself. And by protecting itself, it's trying to get away from the bad things, because tartar and plaque are ultimately just a bunch of bacteria blobbed together. Either if it's gooey or if it's hard, it's still bacteria in the end. And so what the body does is it tries to protect itself from it. And in the mouth, the way that it's going to do that is both the gums and the bone start running away from it, or getting away from the tartar. And that's not good. Why? Because the bone is what holds your tooth in place in your mouth. The bone is all around the tooth. And then on top of the bone and all that stuff, because there's more that goes into it, but just in layman's terms. So the bone holds the teeth, and then on top you have the gums protecting the bone and the roots of the tooth. So if bone starts running away or getting away from the tartar, that means that the bone is not really holding on to the teeth anymore. And wherever the bone goes, the gums want to follow the bone. So if the bone is kind of, let's say we're talking about a bottom tooth. If this is the bottom tooth, right? And this is the bone covering the tooth. And let's say that we have a lot of like tartar and plaque right here, and the bone is right there. It starts kind of running away from it. And the gums are gonna go down as well. And if there's less and less bone covering that tooth, that means that there's nothing to hold on to it anymore. And the tooth can start wiggling and essentially losing that tooth or teeth. So definitely what's important here is, yes, cavities are important, and I need a crown, and I want a denture, and or a partial denture, and things like that. But it all starts with having the environment clean, and environment includes what's underneath your gums. It includes the bone and everything around the teeth. So I guess the message for this presentation is to go to your 6-month cleanings. And once you are at a gum disease stage, if you know that you have periodontitis, then it's recommended to go more often than 6 months. Because every 6 months is more for like maintenance. Your gums are healthy, and your bone level is healthy as well. But once you're at a gum disease stage, that means you have less bone, and now plaque and tartar can accumulate more and easier, unfortunately. And once a bone is lost and gum is lost, that's pretty much it. There's no really you brushing more and regaining that bone or gums back. So if you do know you have periodontitis, then it's recommended to go about every 3 months for cleanings and maintenance. And even though, one might think, well, I mean, if I already lost the bone and I already lost the gums, then why do I have to keep going back for more maintenance, right? And pretty much the answer to that is that, yes, even though you've already lost that bone and lost that gum level, it means that we have to stop the disease. Not, of course, like cure it, but at least stop it and make it stable to where you don't continue to keep losing bone and continue to keep losing your gum levels. Because if we get all that nasty stuff out, like bacteria and plaque, tartar, at least the gums are more relaxed and they have time to heal and they're not so irritated. Because brushing and then seeing that you're bleeding when you brush is not normal. One might think that, oh yeah, it happens to me all the time. When I brush, I bleed. But it's actually not normal, and it's indicative that something is going on. And maybe there's plaque that's irritating the gums, and that's basically the gums kind of screaming like, hey, like something's here that's bothering me. So that can be a start. But yeah, I try to kind of summarize it as much as possible and not confuse you guys, especially when I don't have a lot of visuals to give and I'm not there in person to answer any questions. But yeah, I really love dentistry, and I hear almost every day, oh, I'm scared to go to the dentist, or I hate the dentist. I'm used to that and I've accepted it, but it's okay. I love people and I love to teach dentistry, so I hope that you give it a chance, and because it's important. Anything that happens here affects your overall health. And so thank you very much for listening. Goodbye.